നന്മകൾ വറ്റാത്ത ഇടങ്ങളിലേക്ക് നേരോടി നിർഭയം നീട്ടിപ്പിടിച്ച വാൽക്കണ്ണാടി.
വാൽക്കണ്ണാടിയിലേക്ക് ഏവർക്കും സ്വാഗതം. ഞാൻ കോരസൻ, ന്യൂയോർക്കിൽ നിന്നും. കുടിയേറ്റ ഭൂമിയിൽ വീരഗാഥകൾ രചിച്ച വളരെയധികം മലയാളികളുണ്ട്. എന്നാൽ ന്യൂയോർക്ക് സിറ്റി, ബിഗ് ആപ്പിൾ എന്ന് പറയുന്ന ലോകത്തിൻ്റെ തലസ്ഥാനത്ത് ഈ വരുന്ന തെരഞ്ഞെടുപ്പിനെ നേരിടുന്ന ഒരു ധീര വനിതയുണ്ട്. ഡോക്ടർ ദേവി നമ്പിപ്പറമ്പിൽ. വാൽക്കണ്ണാടിയിലൂടെ മലയാളികൾക്ക് പരിചയപ്പെടുത്തുകയാണ് ഡോക്ടർ ദേവിയെ. ഹാർവാർഡ് എഡ്യൂക്കേറ്റഡ്, NYU സ്കൂൾ ഓഫ് മെഡിസിനിലെ അസോസിയേറ്റ് പ്രൊഫസർ, ന്യൂയോർക്കിൽ സിറ്റിയിൽ പ്രാക്ടീസ് ചെയ്യുന്ന പെയിൻ മെഡിക്കേഷൻ്റെ ഒരു ഡോക്ടറാണ്. ഈ തിരഞ്ഞെടുപ്പിൽ ഡോക്ടർ ദേവി എത്തിച്ചേരാനുള്ള കാരണങ്ങളാണ് നമ്മുടെ മുമ്പിലേക്ക് ഇവിടെ നിർത്തുന്നത്. ചെറിയ ഒരു കാലഘട്ടത്തിൽ ഒരു വലിയ ലോകത്തെ തിരിച്ചറിഞ്ഞ, ജീവിതത്തിൻ്റെ കനലിലൂടെ നടന്ന് ജീവിതത്തിൻ്റെ പുതിയ വീക്ഷണങ്ങൾ കണ്ടുപിടിച്ച ഡോക്ടർ ദേവിയെ വാൽക്കണ്ണാടിയിലേക്ക് സ്വാഗതം ചെയ്യുന്നു.
താങ്ക് യു.
ഡോക്ടർ ദേവി, മലയാളം പറയാൻ ബുദ്ധിമുട്ടുണ്ടെന്നറിയാം. അതുകൊണ്ട് നമുക്കൊരു മിക്സ് ലാംഗ്വേജിൽ ചോദിച്ചു പോകാം. Okay, how are you doing today?
Great. Thank you. Thank you for having me also.
Thanks for coming. And can you just let us know who you are and why you are in this race?
Sure. So my name's Devi Nambiparampil, and I'm a Malayali. I was born in New York. I'm a lifelong New Yorker. I was born at NYU, where I still am now. My parents are Joseph and Mary Nambiparampil, and my father comes from close to Thorubara. It's a small village called Kalur, and my mom is from Cherthala, both from Kerala State. My in-laws come from Alapi and from Thrissur, and we were actually there in February 2020, right as COVID was starting. We were lucky to be able to come back. I'm actually in this race because of the COVID pandemic. So
let the audience know that what you're contesting for. Actually, she's contesting for public advocate for New York City. That means the second line of command of the control of the New York City. Right after mayor, if mayor having any problem in handling the New York City affairs, public advocate will be the next mayor. So it's a very important position.
Yeah. So the public advocate pretty much controls on its own sort of the transparency of the city data. Public advocate has a seat sort of on every commission for the city and has access to the data of all the city agencies. So it sounds sort of like an unclear position. What does that mean? But that means that the public advocate knows exactly how the city is run, how the budget is run, where the money is spent. And the public advocate used to publish all of that data in something called the data directory for the public. So what does that mean? That means if you know exactly where money is being spent, you know if there's any corruption or any bureaucracy, any mismanagement, you can control those things. So all these things that have been happening in New York City, whether it's problems with the pandemic or the flooding in Queens, for example, that happened recently with Hurricane Ida, all of these problems can be addressed.
But this is an independent authority or apart from the city administration?
It's part of the administration, but it's somebody that can provide oversight. So if something is going wrong, the public advocate doesn't necessarily, they're not a dictator, so they can't immediately change the law.
You can bring back bills.
Exactly.
Right? And support bills, but you cannot have the vote.
You can't vote, but you can skip multiple layers of bureaucracy, so you can write a bill and then you can introduce it to the city council, and you can also publicize the data almost immediately if you choose to. So that means that the press can have access to that data and then talk about it. You can let other people know so that they could take action immediately. So one agency can have oversight over another. But because this data stopped getting published back in 1993, there's always an element of confusion where the city doesn't know what's happening. So people don't know if something bad happens, why did it happen? And there's an element of mystery. Right. So I'm running because I think we need a lot more transparency and accountability about what's happening. And as a physician, I saw it most with the COVID pandemic. All these people dying.
I'll come back to your physician, your medical background. Let me see what are, right after the mayor,
Yeah.
If the mayor is incapacitated or in any situations, you'll be stepping in as a mayor.
Yes.
So you every day you had to follow through what a mayor does. Right?
Yeah.
From every, this is a city with $100 billion. This
Yeah.
is a huge amount. So that big budget, so you had to follow every nook and corner of the budget, right?
Yeah,
That's good.
exactly.
Interesting.
Yeah, it's a massive budget. And when we talk about budgets, you know, there's almost $1 billion that went missing with the Thrive NYC program for the homeless, right? So
Yeah.
that's over the past couple years. I mean, that's not debated. So Politico, which is a very liberal, relatively publication, and conservative papers say it's even more than $1 billion, but they all agree it's around $1 billion that went missing during this administration.
$1 billion missing?
Yeah, the range is somewhere between $800 million or 1.3 billion, but it's unclear what happened to that money during this administration. It was supposed to be to treat the homeless and the mentally ill,
Okay.
but the city says it's sort of unaccounted for how it was spent. So all three, the mayor, the public advocate, and the comptroller should know where it was spent, but it's not really known. So
the public advocate should be a watchdog of the government, right?
Exactly.
It should not be the same party. Now, how can you monitor a person who is a friend? It's a partner.
Yeah, I mean, they could, in theory, maybe be the same party, but they should at least have some checks and balances in the system, right?
Independent support.
Exactly,
Oh.
yeah.
Oh, okay.
Yeah, some desire to make that information public. So even with the data directory, let's say, if you're consistently publishing it, even if you are in the same party, well, the data is going to be there so the press can see it. But if you
Right.
stop publishing it, then how can anyone know what's going on? Yeah.
So what made you run for this race?
Yeah, so I started running because before that, I always thought, okay, well, people, because I was focused on my field, which was medicine, I thought, well, people who know better than me are involved in politics, and I was focused on what I was doing.
Right.
But then during this past year with the pandemic, I decided, enough happened all at once that I had to change my life's path. So I was always involved in trying to help people. Just as a physician, I think that's kind of the calling, right? But I sort of lost all these things that mattered to me in a short period of time, and it was enough to kind of change my direction. So, what I mean is that at the start of the pandemic, daycare closed, which a lot of people had this problem, whether with childcare or taking care of an elder parent or a spouse, somebody who was sick or somebody who needed care. For me, it was daycare. So my 2-year-old, I couldn't take care of her and take care of patients at the same time. It was just not possible. I do spine procedures.
You're talking about last year.
2020, yes,
Yeah,
at the
when
start
New
of the
York City
pandemic.
was hit hard on the COVID, right?
Yeah, exactly. So there was a
And
lockdown.
You yourself also having COVID.
Yes, I got COVID later also myself, but at the start of it, it was really not the virus, but the measures to control the virus that caused a problem for me.
That's before the vaccination coming.
Oh yeah, so at the start of March 2020, what the idea was let's close everything down, everybody stay inside for 2 weeks, and we're going to try only medical personnel, what was called essential workers, which I think is kind of a polarizing term, but anyway, polarizing because it means other people are not essential.
Right.
But in any case, that was the term used. So they said, okay, essential workers work, but everybody else has to stay in. But the problem is I had to work, but I don't have anybody to watch the child. My husband can't do this like 24/7. So our problem is that, what do we do now? So my parents, I was lucky that they were able to watch her, but I thought, okay, that'll be 2 weeks. They'll watch her. It's not that easy because they're kind of older with medical problems. A 2-year-old is not that easy to watch. And there was no way I can bring her to work with me because I do spine procedures. These are very delicate procedures,
Yeah, very
like a
focused,
surgical procedure. Exactly. So you're bringing someone to the operating room.
More stressful.
And you can't have a 2-year-old there and all of this under radiation, right? So, because they're under live x-ray.
Right.
So she went for 2 weeks. I thought she would be back. That's the longest time she had ever been away. But I did not see her for 8 months because every day it was the same type of problem. And the reason I was still working, because I could have left my job too, but I own a medical practice, a private practice.
You have patients to take care of also, right?
Well, but I could have closed the practice. But if I did that, then what would happen is that they would have had to go to the emergency room because they're not going to find a doctor in the middle of a pandemic just out of the blue, a new doctor. But if I close my practice, these are nerve blocks for people who have metastatic cancer, HIV, they're disabled, there's all kinds of problems. They're not going to be able to find somebody. So if they go to the ER, it's a death sentence at that time because COVID was more deadly. So I didn't see my child. Then I was watching all these press conferences of what Congress was doing, which to me was very upsetting, and what the city and the state was doing. Then at the end of 8 months, I had lost a lot of money in this practice because it's like any small business, right? So the money wasn't as disruptive to me, because I thought I can make it back, but it was very upsetting because you're paying the rent, you're paying employees, you're paying everybody else. But I had to convince employees to continue to work in dangerous conditions, and
but city didn't give any support.
No, so the city has two things. So they said, like, if you let your employees go, there's unemployment benefits, right? So I did let my employees go, not in an antagonistic way. I asked my employees what they want to do. So the part-time employees wanted to go because they actually make more money on unemployment than working for me. So I told them, okay, I'll do that. So I did, but the problem was I couldn't take care of the patients, because you have to take care of the patients still. You can't just be open and then not have enough staff.
Take care of the family, take care of the business, and take care of the patients.
Yeah, so then I asked the employees to come back. So I actually felt bad because they have to give up their benefits to come work for me. So they're risking their safety on the subway between the crime and COVID to help the patients too, but they don't get any benefits for working. So I'm not against the unemployment benefits. I don't want to sound like I am. I'm not. But I thought they should get something for working, but I can't give them more because I'm also losing much more to do this. Because how do people get paid? At least in our field, it's through health insurance companies, right? But health insurance companies were not paying more during this time. They were paying less because they said, oh, we should be paid less.
So what kind of area you're focused into? Your practice is basically on pain management?
Pain management. So I'm not saying this is solely about medicine. This is all small business owners, right? Because if you look at it, all small business owners are kind of having a difficult time during this, because the way that our city is kind of being managed, or even if you look at the larger country, right? We want to advocate for workers, but workers then, if they should be paid more, however we're paid, that system of getting paid has to be looked at more closely. So if health insurance or property insurance or everything else, if they're supposed to pay you more, there is no pandemic insurance. So nobody gets paid more, but then the workers are suffering, right?
So in other words, you are advocating for the workers as well as the small business people.
Yeah, exactly.
So
both the owners and the workers.
That's the line you thought of running.
Exactly. That's part of the problem. I feel like the way the city is running right now with its laws is as though the business owners and the workers are fighting each other. But in fact, they're both suffering because of the way that the policies are. And then you have, billionaires kind of making more money off the whole situation. I mean, if we look at it from a larger perspective, like the way the laws are, even tenants and landlords are fighting each other. But depending on the situation, some of these small landlords are suffering, the tenants are suffering too, but other people are making a lot of money. So I feel like a lot of the policies that the city has turn people who are suffering against each other without looking at who's making money off the whole thing.
But the way you said that, some people are making more money.
Yeah.
That's you are running on a conservative line.
Yeah.
And Republican Party.
Yeah.
So you think that some people are making money and the other people are not making money. So it's a kind of arguing for the middle people.
Yeah. Yeah.
Okay, that's good.
Yeah.
So
I mean, for fairness. Yeah.
Yeah, should be justice and fair.
Yeah.
Yeah, that's good.
I mean, I think my platform is about fairness, transparency, and predictability, because I think the thing that's making people most stressed out about this whole situation is that it's so unpredictable, that people can't plan, because every time they try to plan something, there's some unpredictable event. Like, if we look at restaurants, for example, okay, a year ago, this is not my area, but they said to the restaurants, okay, we're going to be closed. There's not going to be any indoor dining. You have to do outdoor dining. So I saw restaurants in my area spend a fortune getting all this outdoor stuff ready, building all these things, all this construction to have outdoor restaurants. Then in no time there was indoor dining. So they wasted all that money doing that, getting permits, doing all this stuff, completely unpredictable. For what? Nothing, you know?
So, well, this is something new,
Yeah.
and nobody knows what to do, and there is no, guidance or,
Well-
nowhere to refer to.
Well, we say that. I mean, so to be fair, some things are new,
Yeah.
and you
So,
know you can't control
if
it.
you are a mayor, what do you
Yeah.
do?
So I think, what I find to be most difficult is that there are some things that are unknown. Obviously, whether, you're mayor, public advocate, or anybody who who's in charge of something, there's always unknown. Like in medicine, there's unknown. I don't know with diseases and everything else, like what's going to happen to a specific patient. And it's life and death decisions for those folks, right? But you try to figure out what the problem is before you make massive decisions, major decisions. So you try to get all the data first and then kind of systematically like give people risks and benefits and make decisions, right?
Okay.
But here I feel like there's somewhat of a careless approach to things, and then people are like, oh, well, we had no idea, it's an unknown. So I think we have to eliminate that. Like, again, bringing it back to COVID. So you mentioned I was a patient. My husband had COVID. He was in the hospital for a couple weeks.
And he was on ventilator.
Well, he wasn't on a ventilation, but he was on oxygen, yeah. So he was pretty sick, so he was pretty sick, and I had to call 911 for him, they had to come take him away in an ambulance. For me, I had COVID too, and I started having contractions during that time, and by that time...
You were pregnant at the time.
Yeah, I was pregnant with another, my second one.
Okay.
And by that time, we had my toddler back. We brought her back because I thought, I didn't want her to feel like she was being replaced by the second baby. So I called the city because I thought, I need help because now my small child doesn't have, I can't give her back to my parents because she has COVID too. So the mentality of the city was that I did not provide a safe environment for my child. So they were going to...
I can't believe that.
I know. But that's what I mean about the mentality of the city. Like, I have not provided a safe environment, even though I was trying to help the patients, trying to do all this stuff. So they're going to take her and maybe put her in a foster care orphanage or something in this time. Yeah. Now, I don't know the person who I'm talking to. Is this a person in power or is this a random person on the phone? Who knows? But this is the attitude, not to help people, but to punish people, right? So I think this is the problem right now in our government, that there is a mentality of punishing people, not necessarily helping people who are in trouble. And I saw that as a business owner too, because in the middle of this pandemic, they came to inspect us to try to get fines on us. I didn't get any, so I'm not complaining. There were no fines.
I always wonder, why mostly the public advocates are coming from as a politician.
Yeah.
So you're coming from a medical background as a doctor, and as a medical doctor, and you experience the life of people. And sometimes, you know the pain management, you're in the pain management.
Yeah.
So you saw the suffering of the people on everyday life, every day.
Yeah.
And so, you don't have that feeling. Sometimes you see, things every day.
Yeah.
Those, that emotions. So I thought that the doctors normally don't have that empathy or, not I'm saying that they are kind, not the kind, unkind people. But they're lost because every day they're seeing it.
Yeah.
But the politicians are more related to people. But now you're running as for a public advocate.
Yeah.
From a medical background. That was always surprised me. So now you know that this is the reason. You experience a different experience than other people.
I mean, well, as a doctor, I've seen maybe. I don't know if it's doctor or as a pain physician, but I feel like I treat people with disabilities. I treat people who are suffering. So for almost 20 years, that's all I've heard, stories of pain and suffering. Every single patient who sees me has pain. Otherwise, they won't be talking to me. But that's all I hear, people who are having all these problems. And then the thing about the pandemic was they're all taking care of somebody else, where I thought, this is impossible. How is this person taking care of this other person? That's crazy, But then, but this is where I think that I went through this for a reason, for some, because I've heard this for 20 years, all kinds of horror stories, But then I thought, this is horrible. I'm going to help this person with their problem. And that's what I did for all these years. I've treated people who've been raped. I've treated people with domestic abuse, homeless people, veterans, combat veterans with blast injuries, people who have lost their legs, spinal cord injuries, all kinds of abuse.
You worked with the VA, right?
Oh yeah, for several years. I've treated people who are refugees from Cambodia, tortured by the Khmer Rouge, all kinds of stuff. But but I didn't change my life. But now I'm changing my entire life because I thought, every single thing that I cared about, I lost temporarily. But I lost, my business looked like it was going to fail. I lost my child temporarily. I thought my husband was going to die. I thought my unborn baby was going to die. Then I thought I was going to die. So then, it all came back. I'm okay. So I don't want to make it sound, but I thought, what is it all for then? What is the point of all of this? So then I decided to run. And then
you made the point, actually, you had a different experience than anybody else in this race. So you made clear that, why you're running for the public advocate, so that you've gone through a lot of trouble and you face difficulties in the life, and you can help people with the similar kind of situations.
Yeah, I think,
That's good. Yeah.
What is this life for?
Exactly. Yeah, you made the exact point. Yeah. Speaking about the election, so you are running on the Republican line, and you are the only candidate running on the conservative line, or there is anybody else?
Well, conservative line is different. So there's the Republican line, which I'm on. There's a different candidate on the conservative line. There's a Democrat line too, and then there's one candidate running independently on the Libertarian line.
Okay.
Yeah.
That's good. That's not a factor at all, because normally the public advocates are coming from the Democratic, and normally New York City is a heavily Democratic Party area.
Yeah.
And what do you think that what is your stake on the winnability of this election?
Well, I think it's a winnable race. I mean, so people ask me, why are you running as a Republican in a Democrat city? Why don't you run as a Democrat, right? And there's so many times where I thought, oh, my life would be simpler if I was going to run as a Democrat. But then, like I said, what is it for? You have to run for what you believe in. So what do I believe in? I mean, when I think about it, okay, what are the problems? Well, first, there's something that's nonpartisan. I think that we need to have a city that's without corruption and bureaucracy, right? So that could be any party, that could be anybody, but I think that's priority number one. And then second thing, okay, what are the problems facing the city? Well, we have a problem with crime, right? So to me, it seems we have a problem with crime and violence, and we also need police that have more training so that we can have a more fair system, so that police know what to do. We need safety and stuff, but if you want police with more training so that there's less problems, let's say, in interaction with the community.
Speaking of police, so did you favor the defunding of police?
Well, that's what I was going to say. I am against defunding the police. And I think we need more police, and I think we need better trained police. So even if you're a person who thinks that you're against you're against the police because you think there's a lot of episodes of discrimination. So let's say you think that. If you want to decrease discrimination, then you should want more training for the police, right? But more training costs more time, more time in terms of training, and more money.
Right.
So then you should want more funding for the police, not less. And if you want more funding, that's a Republican idea.
It's actually demoralizing the police.
Right? Yeah, I think so.
New York City is a tough crime-infested area.
Yeah.
And so we need tough policing, right?
Yeah, exactly.
And defunding police means that, you are demoralizing the police. So it should not be a part of the New York City policy, because when Giuliani was the mayor and the Republican line at the time, the crime rate came down, right?
Yeah.
And I'm not I'm not talking about the partisan situation.
Yeah.
But as working in the New York City, I felt that during Giuliani's period, we feel more safe.
Oh yeah.
Because the policing was better.
And 9/11.
And homelessness now. So that's a big issue.
Oh, yeah. It's a big problem. I mean, poorer communities are suffering more. And then I also think when I mentioned 9/11, I mean, I got a notice just even for my business that our insurance premiums are going up for terrorism. My office is in the financial district.
Oh, okay.
So these insurance companies do calculations, right? So they said that our risk of getting blown up by terrorists has gone up according to their calculations. This is a month ago, so this is before anything happened in Afghanistan. But our risk has gone up, so they're increasing our premiums and they're capping what they will cover.
Right.
So they've decided just this defund the police has already made it more unsafe. So that's the corporation's view of what's going on around here in New York City.
Like you said, because the Afghan situation,
That's even
any
worse.
kind of terror issue, New York City will be the first target.
Yeah.
And so if you can see that, right after the September 11, New York City is going to be facing a tough area. And as a public advocate,
Yeah.
what is your stake on that?
Well, I think it's important. We have to keep people safe. So, the most important thing is to save lives, to prevent death and disability. Whether you're a doctor, you're a public advocate,
Right.
you're a police officer, that's what you have to do, right?
Yeah.
So here we need to have police and we need to have better trained police. I mean, I worked at the VA, and the difference I saw between these wars in Iraq and Afghanistan, and let's say the veterans I saw returning from Vietnam,
Right.
the ones that went to Iraq and Afghanistan were much better trained. So even though they faced much worse in terms of all the weapons used against them and stuff, they survived.
Right.
So the difference was they were much better trained. The ones that went to Vietnam that had to face the draft and all these other things, they suffered much worse physically, psychologically, I think, just as a large group. So I think for the police, there's so many things against them right now, aside from just being demoralized on top of everything else. It's not just the police that keep our community safe. The community has to work with the police, right? So the police don't know automatically where crime is occurring. They actually rely on people telling them and reporting crimes and having a community watch and having all of these things going on. If people don't want to work with the police, there's no way the police can go stop the crime, right?
Exactly.
Then on top of that, you also have to have sort of some trust between the police and the neighborhood. If the police are underfunded and can't go respond to the crime, the community loses confidence and loses faith. So the crime will only get worse.
Speaking of the veterans, the New York City having a big issue with the homelessness. And if you you happen to travel through to the subways, you can see in every car there is somebody sleeping there.
Yeah.
And I don't know, the city is not addressing the situation seriously, or the New York Transit is not focusing on the area, because in most of the morning times when we try to rush to the office, sometimes the cars, it's so messy and smelly, and we can't even take the public transportation.
Yeah.
And adding to that, I can see so many people with the brown paper writing, I'm a military veteran, give me some money.
Yeah.
And they're begging in the street. So what's happening in the city now?
It's interesting you mention it because, so when I was working in 2020, I still take the subways now, but in 2020, I was taking the subways every day, even when I was pregnant, and I got assaulted in the subway. I actually think the situation was worse in 2020, yeah. I mean, so I was pregnant, this is like the second trimester, sitting in the subway. The cars were deserted because nobody would take the subway, everybody was still kind of staying at home. This person was like boxing on either side of my head, like screaming, and I kind of thought, I wonder if this is going to end while he's punching either side of my head with him punching me in the face. So I thought maybe I should just like move out of the way. But then I thought, if I move my head or something, maybe he'll punch me in the belly. That'll kill my baby. So maybe it's just better if I stay here and let him punch me in the head. But these are the decisions like you have to go through, like wondering. But every day, like riding the subway is kind of like a nightmare in 2020. But the thing I was thinking after when I decided to run was like, because I saw an interview where somebody said, oh, nobody reports these crimes because, and I didn't report the crime. But the reason I didn't report the crime was because I saw the cameras everywhere in the subway, and I thought, well, if anybody wants to do something, they will, but nobody's doing anything, so why do I want to then spend my time reporting this, right? But the thing is, like you said, people can see all this and nothing happens. So
This is
there's a loss of confidence.
Yeah, we experience every day. New Yorkers experience a similar kind of situation.
Yeah.
There is no, as a public advocate, you can do a better understanding of the situation.
Yeah. So I think, that it's not a one-step solution, but there's several things. Like, first of all, who are the folks that are on the subway? Because first of all, you mentioned they're carrying these signs. Are they veterans or not? Because if they're veterans, the VA has money to address homelessness. Right. And then we have to find out what's going on in terms of the VA outreach programs. I worked at the VA, so I know they have money for that. Are these people also that have qualify for other social outreach programs? Because there's money if they are people that are homeless but qualify for other programs. Right. Let's use that. If it's not, are they New Yorkers? Because maybe they're not New Yorkers, and what's going on there,
Porn artists, maybe.
Well, maybe not. But when I think of homelessness, I think of other things too, because I've treated a lot of patients. I would say arguably over 1,000 patients that are homeless, right. But they're not all on the subway like this. Like, the thing is, a lot of people are homeless, but they don't immediately go to the street and ride the subways. What happens is, if you lose your home, which actually I was kind of in this category, displaced is what you call it, like after Hurricane Sandy, you don't immediately go to the street. You go live with somebody that boyfriend, girlfriend, spouse, like parents, somebody else, because that's kind of what you do for a long time, right?